Hey everyone, Dr. K here, trying something new. I've been having a lot of trouble writing about high-risk pregnancy and just writing in general, so I thought I'd try talking. If this works, maybe we'll do it once every couple of weeks or so. The topic I've been thinking about a lot is actually something that comes up in my work, which is protectiveness. People feel very protective towards pregnant patients. They feel very protective towards fetuses, sometimes more than they do towards pregnant patients. What's interesting about this, though, is you sometimes have to think about who's really being served. I have pregnant patients that are often not offered what they should be. It's well known that pregnant patients with abdominal pain may not be offered imaging studies in time and may not be offered the surgery that they need. And although this is putatively because we want to protect the fetus from radiation, the end result is that sometimes they don't get the surgery they need and get much sicker. A few years ago, I had a patient who had such profound nausea and vomiting from pregnancy that she had not eaten for months, and her nutritional status was really, really tenuous. She should have been offered a G-tube, a tube where she could have been fed directly into her intestines. But this wasn't done because the teams that could place it felt really uncomfortable about working on a pregnant woman. So instead, she was maintained on IV fluids and then IV nutrition for days and then weeks and then months. And ultimately, she ended up getting both very poor nutrition and quite sick from line sepsis. All of that could have been avoided if she had had a G-tube placed, which is a low-risk procedure, when she was 10 or 12 weeks pregnant, when it became clear that she needed something. But they were feeling protective, so they didn't do it. And then later, they were feeling even more protective as the pregnancy progressed, so they didn't do it. And ultimately, she got febrile and very, very sick. And I think this is something that happens a lot. We sometimes need to think about whether or not this is protectiveness, or that protectiveness is just discrimination in prettier clothes.